Good morning everyone. So last class I started the blood bank. Blood bank is a specialized medical center where blood of different groups are collected. So if there is any emergency, the blood can be transfused. It is mixed with anticoagulants, so like anticoagulants that will prevent the coagulation. Anticoagulants like EDTA or acid citrate with dextrose or D-glucose can be mixed, and the temperature will be maintained at 4 degrees Celsius, and we can preserve the blood from 3 weeks to 21 or 21 days. So these are when the blood transfusion is required. So in the condition like hemorrhage, the whole blood are transferred. So in severe anemia, there is a packed cell transfusion in severe anemia, then fresh blood transfusion in hemophilia, plasma transfusion in burns, exchange transfusion when the newborn infant is suffering from a erythroblastosis fetalis. So these things I already told. Then coming to dangers of blood transfusion. Okay. So the dangers or hazards can be classified into two. One is because of compatible blood transfusion and because of incompatible blood transfusion. So compatible means the same blood group. Okay. So the dangers or the disease or hazards will occur because the same, if you transfer the same type of blood group, so compatible blood group. Okay. If you transfer also, some of the disease will transfer. The next one is incompatible blood transfusion. Okay. Incompatible means the blood groups are not matching. We will see now the dangers associated with compatible blood group. Okay. So if you are not screening properly, there is a transmission of disease like AIDS, viral hepatitis, syphilis and malaria. Okay, can be transferred. Overloading and rapid transfusion will affect the heart if the volume of blood transferred is more than what is required. So what will happen if you give more blood? Okay, if you transfer more blood than the normal, means, so if the person required only 500 ml of blood, so if you give more than that, so what will happen? There is a load on the load on rapid transfusion, so load on the heart will be increases, so that will leads to a disease. Then ionic imbalance will lead to hypokalemia, hypocalcemia. So these are the ionics. So if the calcium increases or calcium level or potassium level increases, that will cause the excitability of the nerve and muscle. This is compatible blood. In a incompatible blood, so if you give mismatch blood, means A positive person give blood to the B positive, so what will happen? The antibodies are present in the blood, right, of a recipient. So donor's antigen react with the recipient antibody. Okay, understood? So that will leads to we classified this severity of the reaction into minor reaction, moderate reaction and severe reaction. So minor reaction, inapparent hemolysis means the donor's red blood cells will react with the recipient plasma, so the hemolysis takes place. So just write the minor reaction. First is the hemolysis. Okay. Then in a moderate reaction, so after 2 days, the what will happen? If the hemolysis is severe, the bilirubin level increases, right? Bilirubin level increases, so that will develop a jaundice. So write that much is enough. So bilirubin level increases and the person develop jaundice. In a severe reaction, okay, severe reaction, what will happen? The agglutinated mass which is in circulation block the capillaries. So that means, so if agglutination antigen antibody reaction is taking place, right? So agglutination mass means the content will remain in circulation and that will block the capillaries, okay, that will block the capillaries and the blood flow through the organs and tissue will suffer. Capillaries means the blood vessels, okay, thin blood vessels. So what will happen first? So hemolysis, all the donors hemolysis so in severe condition then it will block the capillaries, the agglutinated mass block the capillaries, that will leads to blood flow to the organs will be decreases, that will compress the chest and back side, so leads to failure of organs like kidney and heart failure and kidney failure. So kidney failure occurs because of the blocking of hemoglobin into renal tubules, blocking of hemoglobin into renal tissue. So that much is enough, okay. So very important, so they will in the blood group they will ask the question ABO blood group, then Rh incompatibility or erythroblastosis fetalis, then hazards of mismatch blood transfusion or ABO incompatibility. So all are same, you have to write these answers. So next topic is leukocytes. Leukocytes, you know, these are the WBC cells. So like RBC we finished, now it is leukocytes. So WBC are the only nucleated cell in circulation, okay. So RBCs are anucleated, nucleus is not present, but the WBC cells are having a nucleus, okay, having a nucleus. The size the cell range from 8 mu to 22 mu, and if you compare with the RBC, the count is very less. So that is 1 in 700. So that means 700 RBCs are present cells and 1 WBC cells, okay. Then the normal count it is 4000 to 11,000 cubic mm of blood. So this is 3 phases in the life can be synthesized. One is the marrow, that synthesis takes place, then circulation, then it is going to the tissue macrophages. So coming to the in RBC only one type of RBCs are present, but in leukocytes, so it is classified into 2 types. One is granulocytes and agranulocytes, okay, granulocytes and agranulocytes. So in the granulocytes it is divided into 3 types. One is neutrophil, eosinophil and basophil. Very important, okay, classification. So granulocytes and agranulocytes, I will tell later what is granulocytes and agranulocytes. So granulocytes, under granulocytes neutrophil, eosinophil and basophil. Under agranulocytes lymphocytes and monocyte. So the names you should learn, okay. So next we'll see the features of neutrophil. So neutrophils are higher in number, okay. So total 50 to 70 of total leukocytes, the total WBC cells, the neutrophil is more compared to 5. So other 5 are there, right. In that total 50 to 70% the neutrophils are present. The cell size is 10 to 12 mu in diameter, And if you see the cytoplasm, coming to the cytoplasm, so suppose, so this is neutrophil cells. In cytoplasm the nucleus are multi-lobe, so lobes are present, it is looks like this, okay. Multi-lobe means whether 2 lobes or 3 lobes or 4, okay. So older cells have more lobes, means if it is only 2 or 3 it is younger, so if it is more than 4 or 5 lobes that is older, okay. Next come to lifespan, so 2 to 5 days. Cytoplasm, okay, so the next is a cytoplasm. So this is the lobes, okay. So cytoplasm contain fine granules, okay, fine granules, like these are the granules, so hence the name is granulocytes, okay. Cytoplasm contain fine granules and it contains both acidic and basic stain, so both yellow and pink and blue color granules you can see, so that is neutrophils. So coming to the, so it's the same thing, cytoplasm contain bluish in color, contain fine granules, and these granules are neutrophilic in nature. Neutrophil means both, neutral, okay. And enzymes like glycosidase, sulfatase, phosphatase, nuclease and proteolytic enzymes. So these neutrophils can lyse any type of substance, any type of foreign particles, and hence it is the name as a lysosomes. So the main function of WBC cells are leukocytes to fight against infective disease or bacteria. So any bacteria or viral disease. So these WBC count increases, and main function of WBC is to fight against harmful pathogens like bacteria, virus, fungi and parasites, okay. So otherwise what will happen, so they will lead to a disease. So in that the neutrophil has a major role. So this is the condition where the neutrophil count increases and decreases. So it is increases physiological conditions like during exercise, pregnancy and lactation, and pathological means pyogenic infection, bacterial infection, tissue destruction and all, it will increases. Neutropenia means decrease in neutrophil count. When it will decrease, any viral infections you have to note, write. So a bacterial infection it will increase, viral infection it will decrease. So typhoid fever and all, it will increases. So next, the functions of neutrophils are very important. The main function of neutrophil is destruction of microorganisms, okay, by phagocytosis. So phagocytosis is a process in which the body's first line of defense against a bacterial infection. Functions of neutrophil: phagocytosis. Phagocytosis is the body's first line of defense. First line of defense against bacterial infection. Next, the functions of neutrophil. So this phagocytosis, the phagocytosis means a process. I will tell next what is phagocytosis. Is a process of egestion and destruction of microorganisms by the cells. Egestion means to take inside, okay. This cell will take the microorganism inside and cause the destruction, means destroy the microorganism, okay. They contain a fever producing substance, okay. They contain fever fever producing substance called endogenous pyrogen. Okay, endogenous pyrogen. So it is an important mediator for febrile response. So these things are, if you remember, you write. So just write, it produces a fever producing substance called endogenous pyrogen. So you will, any bacterial infection, so this WBC count increases. So through phagocytosis process, it will fight with the bacteria. Okay, so that time you will get a fever. Understood? Next, they contain antimicrobial substances called defensin. Okay, antimicrobial. Microbe means microorganism, anti means against. So any microorganisms enter our body. So these cells mainly contain lysosomes, okay, and peroxidase. By the action of lysosomes and peroxidase, so these neutrophil get fight with the microorganism. Understood? So very important, the functions of neutrophils. So next coming to the mechanism of phagocytosis. So how this process, the digestion and digestion or destruction of microorganism is taking place. Okay. Here, so we can see many steps. First one is diapedesis. Okay, diapedesis. Here the emigration or migration of neutrophils from the bloodstream into tissue space. So that means this is the blood, right? This is the blood vessels. So here white blood cells are moving. Okay, white blood cells are there. So any bacterial infection is there, bacteria. So suppose this is bacteria. Okay, any bacteria enter the body. So immediately these neutrophils get come to tissue space. Okay, come to the tissue space. Next, chemotaxis. So chemo means chemical. Okay, some of the agents, chemical agents, so that will attract the neutrophil to the site of injury or inflammation. So wherever the body part get inflammation, so that to there, so these chemical substances attract the neutrophil. Now this neutrophil attack this. Okay, so this neutrophil come and attack this. Like that. So chemotaxis are the chemical agents that attract the neutrophils to the site of injury. After that, there is a system is there, components of complement system, like polypeptides from lymphocytes, basophils and mast cells. Okay, so these will attack the bacteria. Next, opsonization. So opsonization, so opsonization means engulfing. Okay, so these bacteria will IgG antibodies are there that cover the bacteria and make them tasty to phagocytosis. Are you just right? So it is an engulfing of bacteria by neutrophil. So after that, so this neutrophil can remove the 5 to 20 bacteria. Okay, neutrophil can phagocyte or remove 5 to 20 bacteria, and macrophages is another one another leukocyte that can kill 100 bacteria. So macrophages are bigger size. So neutrophils, both are same function, phagocytosis. Okay, both neutrophil and macrophages are same function. Understood? So after that, there's a degranulation, that is proteolytic and lipolytic enzymes get released and digest the bacteria. So that's complete the neutrophil. So neutrophil, so what is the main function of neutrophil? Phagocytosis. Okay. Okay, phagocytosis. So in this picture you can see, so this is bacteria. Okay, so this is the blue color, whatever the blue is there, that is this is WBC cells. Okay, white blood cells. Now when the bacteria come and contact, so these WBC cells, first is the egestion. Okay, so or after that this bacteria will having a coat, it's called phagosome. Okay, so lysosome and phagosome, which is present inside the WBC, will contact with the bacteria. So you can see diagram. So it will digest the bacteria. Okay, phagosome and that form a phagosome. Then lysosome come in contact with the phagosome and form a phagolysosomes. Okay, so when the bacteria enter the cell, so that has a coat. Okay, it form a coat around the bacteria and form a phagosome. Now the lysosome come and contact with the phagosome and form a phagolysosome. So now this lysosome contain digestive materials, okay, digestive substances that will digest the bacteria. So you can see here it will become the granules. Okay, so after that, so this phagolysosome come and contact with the cell membrane. This is the cell membrane of the cell. All the cells are having a cell membrane. Okay, so come and contact with the cell membrane. So through exocytosis, okay, through exocytosis, the substances, the soluble substances, the debris will be waste will be coming out. Okay, this is the process or mechanism of phagocytosis. Okay, so the next, coming to the next cell is eosinophil. Okay, so eosinophil are having a 10 to 12 micron in diameter. So in the total 100%, if you take WBC cells total, 70 to 50 to 70 is leukocytes. Only 1 to 4%, so 1 to 4 cells are leukocytes. Okay. Here the nucleus. So suppose this is the cell, the nucleus are having spectacle shape, bilobe. Okay, and connected with the thick strand. So it looks like a specs. Okay, looks like a, you can see like this, spectacle. Understood? The nucleus is bilobe. So the cytoplasm has coarse granules. Okay, cytoplasm has coarse granules like this, coarse granules, and it looks a pink, reddish color cytoplasm. Okay, reddish color cytoplasm. Next, coming to the functions of eosinophil. So main function is it act against parasites and allergic reaction. So that means it is a anti-allergic in function. So any allergy, skin allergy or any type of allergies, so the eosinophil count increases. Okay. So parasites infection, it will increase. So in this, the granules mainly contain the histamine and lysozymes. So these are the new words. So it is difficult to understand, I know, but what to do? So you have to learn. Okay. So after anatomy, biochemistry classes and all, so you will be familiar with the words. Okay. So granules contain histamine and lysozymes. It will collect at the site of allergic reaction and limit their intensity. So that means it will not present overall the body. Okay. So wherever the infection is there, like if you get respiratory tract infection, like if you have a dust allergy problem, so dust allergy, so in that time it will collected, it will be more number increases, eosinophil count increases, and that get collected in your respiratory tract, like that. So they attack the parasites by releasing the chemicals, so which are toxic to larva, parasitic infection. So that is very important. Okay. So any parasitic infection, so that will acts on the, that will release the chemicals that will toxic to the larva. So larva means it is a younger one, right? These are the functions of eosinophil. Next we will see when it will increase. The eosinophilia means increase the eosinophil count. So any helminthic infection, roundworm, hookworm, filariasis, roundworm, hookworm, that condition, that is the parasitic infection, right? So that time it will increases. And allergic disease like asthma and all, it will increase. Addison disease, it is a hormonal deficiency of the hormones. Eosinopenia, penia means a lower count. Okay. So eosinophil count decreases. So when it will decrease, the condition like Cushing's disease. Okay. Cushing disease and aplastic anemia. Okay. So aplastic anemia, you know, the disease of the bone marrow. If you continuously exposed to X-ray, your bone marrow will not able to synthesize the all the type of blood cells, because from the bone marrow all the blood cells like RBC, WBC, platelets will be, that will produce. Okay. So in Cushing disease, it is also a disease of the hormone. Okay. Deficiency of the hormone like cortisol, it will cause. Then aplastic anemia. Any one or two disease if you remember is enough. So that's complete to eosinophil. Okay. So next go to basophil. So basophil is very least number of leukocyte. So only 1%, less than 1% of the total leukocyte. So as I told, if you take 100%, in 100% only 1%, less than 1, the basophil cells are present. So the cell is round and diameter is 8 to 10 micro in diameter. Okay. It has a coarse granules, but it contains a blue. This is the cell. So nucleus is S shape. Okay, nucleus is S shape. But you can't see the shape properly. So that much the granules are studied like this. Okay, full blue color granules. So this dot what I am writing, these are the granules. So because of these presence of these granules, they have a function. Okay. So next is the, so it is not bilobe. Okay, it is S shape. then the lifespan is 10 to 15 days. Next is the formation of functions of basophils. So granules mainly contain the histamine and heparin. Because of the histamine and heparin, it has a function. Okay. So histamine leads to allergic manifestation. Okay. The histamine which produce the allergic reactions and all in the body, and heparin is an anticoagulant. Okay, very important, naturally occurring anticoagulant in the blood. So because of the presence of heparin in our body, the blood is not get clotted. So only when there is a wound or cutting of the blood vessels, then only the bleeding will take place, right? So normally in circulation, because of presence of heparin is a naturally occurring anticoagulant. So that is important function of basophil, and also a mild phagocytic function also. Next, coming to basophilia, increase in basophil count. So chicken pox, mainly during the chicken pox, smallpox, TB and all, it will increases. Basopenia is decrease basophil count, like drugs induced reaction or after injection of glucocorticoids, so it will decrease. So next, coming to the lymphocyte. So lymphocyte, it is total 25 to 30% are present, total WBC cells. The cell size is 12 to 16 micrometer. It is the, as I told, lymphocyte has a without granules. Okay, the lymphocytes are not having granules. Suppose this is lymphocyte, there is no granules. Okay, and this is nucleus, lymphocyte nucleus. The large centrally placed nucleus are present. Okay, so this is nucleus. So then cytoplasm, so sky blue color, and lymphocytes play a major role in immunity. So main function of lymphocyte is involved in immunity. Okay. So in immunity also there are two types of immunity. T lymphocytes will give cellular immunity, and B lymphocytes give humoral immunity. So T lymphocytes means some of the lymphocytes are developing from thymus. Okay, thymus is a part. So that will form a T lymphocytes that will give a cellular immunity, and the immunity, the next class is only there. So that time I will explain what is cellular and humoral immunity. Then large lymphocytes and small lymphocytes. Small lymphocytes are younger one. Okay, which is also present in the circulation. Based on the size, the function is same. Okay, small lymphocytes 7 to 10 micron, and large lymphocytes are 10 to 40 micron. The structure, function, everything is same. So next, coming to the monocyte. So monocytes are 2 to 8% of total leukocyte. Okay, total leukocyte, 100 cells, 2 to 8 monocytes are present. So compared to other cells, the monocyte is a bigger cell. Okay, monocyte is a bigger cell. Cell size is 10 to 18 micron. And the cytoplasm, the nucleus, in cytoplasm the granules are not present, hence it is called agranulocytes. So here the kidney shape or bean shaped nucleus are present. Okay, so kidney shape or bean shaped nucleus, suppose this is a nucleus, and occupies the 50% of the cell cytoplasm. You can see here. So or horseshoe or kidney shaped nucleus, eccentrically present, not at the center, at one side it is present. So that is monocyte. The functions, you know, the main function is active phagocytosis, like neutrophil. So actually the first is monocyte. Okay, the phagocytic function. So next come to neutrophil. Clear? Phagocytosis you understood, right? Any bacterial infection. So phagocytosis, through phagocytosis process, so it will remove the bacteria or foreign substances in the body. This monocyte, sometimes it also remove the aged neutrophil, basophil, eosinophils and all. Okay. Mature monocytes enter the tissues and become tissue macrophages. It will kill the tumor cells. Okay, it also kill the tumor cells. If the question is function of monocyte, you have to write the phagocytosis, entire thing. Okay, so the count increases the condition like syphilis and TB, decreases during hypoplastic bone marrow disease. Okay, hypoplastic bone marrow. Understood? The function of monocyte, it is a the neutrophil. When there is any infection, the first line of defense is given by neutrophil, then the monocyte. Okay, and also it will digest the dead neutrophil, macrophages, necrotic tissues and all. It will combine with the dead bacteria and form a pus cell. Okay, and form a pus. It can digest 100 bacteria at a time. So that's complete. So now understood. So in WBC leukocytes there is granulocytes and agranulocytes. Granulocytes are neutrophil, eosinophil and basophil, because these cells contain a granules in their cytoplasm. Okay, so granules are also having a function. It contain chemical substances and all that will kill the micro organisms. Agranulocytes are monocytes and lymphocyte. Lymphocytes are mainly involved in immunity. That is very important. Okay, immunity by producing, and also immunoglobulins will be produced. Then coming to the monocytes, so monocytes will give a second line of defense against the microorganism, and also it will digest the other tissue, other dead neutrophils and all. It go to tissue and form a tissue macrophages. Okay, so that is perform a function. This is the overall the cells in the blood. Okay, WBC cells. This is monocyte. So you can see the nucleus, bean shape. This is a large lymphocytes. Okay, this is neutrophil, multi-lobe are present. This is blue color granules are there, so hence it is basophil. This is eosinophil, pink color, red color granules are present. So now the functions of leukocytes means overall function of WBC cells. You can write all the functions of the cells only. So phagocytic function, specific or acquired or active immunity function, role in allergic reaction by eosinophil, and anticoagulant function is by basophil. So that's complete the leukocytes. Okay, so in leukocytes, so very important is they will ask classification of WBC and structure and functions of WBC cells. Okay, so in that time classification you have to write granulocytes and agranulocytes. Granulocytes are neutrophil, basophil and eosinophil. Each structure, how it looks, the cell size, okay, the nucleus, cytoplasm you have to define, and then you have to write the function. Understood? This is a major question. Eosinophil, the cell size, nucleus, cytoplasm, then function. Like that you have to write the entire thing.